Like most of the world, the United States is in the grip of the coronavirus pandemic. But this country has been affected more than any other. More than 1 million people here have contracted COVID-19, and tens of thousands have died. Why is the world's most powerful nation struggling to cope? And what shape will America be in when it emerges on the other side of the crisis?
It's affecting anybody. Everybody should be scared.
It is truly a deadly virus. You know, I was one of the lucky ones. And I think about that every day.
This will change America in so many ways that in 2 years when we look back, we will not remember what things were like before COVID.
Okay, move, everybody move. Everybody out. Up, move, clear, 100, charging.
The patient's heart has stopped. Medical staff have rushed to his bedside. They're fighting to get it restarted. This has become the normal scene at St. Joseph's Hospital in New York. For weeks now, hour after hour, day after day, they try to save the lives of COVID-19 sufferers. The emergency teams are well versed in these situations. It's their job. It's what they signed up to. But this crisis is different. It's the sheer scale of it that's had them reeling.
It's been a nightmare. We have a volume of sick people like you can't believe. In one shift, I pronounced 6 people dead. Many were elderly, but then that's not uniform across the board. There are plenty of other people that you would not think would succumb to this who unfortunately have. I've been in this business for over 20 years, and to a person, no one has ever seen anything like this.
In this case, the patient survived. Thousands upon thousands of people have needed hospital treatment. Understandably, it's taken its toll on those whose job it is to care for them.
I had headaches every single day. Before going into night shift, I was having like chest palpitations, chest pressure, just from like the anxiety and fear of like what was coming. I think a lot of us have accepted the fact that, we're probably going to get this. It's just, we want to survive, we're all being exposed to it at some point.
It just wears you down, I've welled up in tears at times, when we take somebody's loved one out of their home. Nobody's allowed to go with the patients as opposed to before. They would have a family member that could come. There's no visitors in the hospital. You can't go to the waiting room and wait. So we literally just take their loved ones, and oftentimes we know that they will never see them again alive.
The majority of people actually survive COVID-19 and don't need to go to hospital. However, it doesn't mean they too haven't had an appalling experience.
It started with a mild fever. I knew that I had a fever only because I had chills suddenly. And the chills were like nothing I have ever experienced.
Julie Thaler was one of the early contractors of coronavirus in America, one of a cluster of cases in Westchester, New York.
Day after day, I had the symptoms, but I thought, I can get through this. This must be a very mild case. And then my fever spiked to 103. And that's when I got that dreaded COVID cough. And that was very frightening. Like, that was the first time I thought, whoa, like I might be in that 20% statistic.
But America's ability to handle this crisis has been questioned from the beginning. Here, health workers protesting about shortages of medical supplies.
I am seeing people die every single day. We don't have the cleaning supplies that we need. We don't have the space that we need. We don't have the staff that we need. There are refrigerated trucks outside of my hospital. People are dying.
A military plane being unloaded at Joint Andrews Air Base in Maryland. Protective masks, disinfectant and gowns among the items destined for hospitals across America. This was a donation from Turkey to the United States. The country with the world's biggest economy has also had to take deliveries from a range of other nations, from Vietnam to Honduras. But why wasn't America, and indeed other developed nations, fully prepared for a pandemic? After all, scientists had been warning for years that a major outbreak was likely.
We have the best scientists, we have the best research, we have a history throughout the world of dealing with infectious disease outbreaks. And so there is a playbook, there is a lot of information, and if you would ask any public health professional, epidemiologist, vaccinologist, virologist, they would have told you how to manage this. But when push came to shove, whether it was due to a lack of fear in the United States, whether it was due to hubris, whether it was due to a lack of coordination and leadership, or a flow of information, we failed. And at that point, it was already growing out of control.
Well, it certainly feels out of control now. More Americans have died from coronavirus than were killed in the Vietnam War, a conflict which lasted for nearly 20 years. And of course, this is no longer just a health crisis. The need to shut down most of the country for a time has led to a full-scale economic crisis, which is being compared to the Great Depression of the 1930s. Businesses across the country have shut down, putting tens of millions of people out of work.
We closed on March the 17th, which was a Thursday. On Tuesday, our coffee shop was packed. You couldn't even walk in here. And then all of a sudden, a day and a half later, we had to close our doors.
And George Delani has no idea when he'll be able to reopen. Online sales are helping him keep his cafe and chocolate business afloat for now, but relying on that in the long run simply isn't sustainable.
I mean, it's really hard, you know, like you guys are in here today and usually we're used to thinking of this place as full and it's empty and we have no idea of what the future will bring. I mean, this is a true family business, you know, this is like basically our family's business here and we don't know whether we're going to be around, you know, next month or 3 months from now, and where do we go from here?
Judge's wife, Lorena, a dermatologist, is still working, but remotely, giving her patients consultations over the internet.
We have our medical records, and then we have a separate system that's our telehealth system, where we can generate an invitation for the patient.
And this is part of the problem for the health service, is it's not just about coronavirus at all, is it? Everything else is.
Absolutely, because people are still getting sick from other things, but if the hospitals are overwhelmed with a coronavirus patient, then either they're staying home and trying to deal with this on their own, or when they go there, they are at risk of actually picking up coronavirus at the hospital. So it's tough.
Another part of Washington, D.C., another family business. Ben's Chili Bowl has been seen in feature films and television dramas. But this is the toughest period in its 61-year history.
It's been a very devastating experience for us. Pretty suddenly, everything changed. Total shock. And, I have to say that when we're saying community, I mean, it's a global community at this point because everyone in the world is affected, not just Ben's Chili Bowl, not just D.C., not just the U.S., but all over the world. We're all in the same boat right now, I believe.
The diner has always had a celebrity following. Barack Obama ordered food from here virtually every Friday night during his 8 years in the White House. But Ben's Chili Bowl's clientele also includes large numbers of poorer black customers. Statistically, non-whites are more likely to die from coronavirus. As well as highlighting income disparities in America, is the virus also highlighting the racial divide?
People of color, African Americans, Black and brown people in America are dying at disproportionately high rates in this country from COVID-19. They are also being hospitalized at disproportionately high rates. We'll look back on this and call it a health disparity. Those of us who've been in this work for decades look at it as another health inequity, where people don't have the opportunity to really be healthy. They don't have the opportunity to really defend themselves against this virus.
Humanity, not me.
But one of the biggest divides in American society at the moment is between those who think it's vital to continue the lockdowns and those who want the country reopened for business.
We, the people of this great state, will be heard. Reopen North Carolina.
And they have a president seeking re-election in November who's desperate to revive the economy. Whatever the scientific evidence, Donald Trump has consistently called for the restrictions to be lifted as quickly as possible.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
In the past, the US would have been expected to take the lead in a global crisis like this one. In fact, it's turned inward, withdrawing funding from the World Health Organization, for example, refusing to take part in a multinational project to find a vaccine. And there's already a determination to reduce the dependence on other nations for medicines and medical supplies. But whether such an insular approach will help America deal with any future pandemic is already being fiercely debated.
You can't create recreate the Soviet Iron Curtain around the United States and hermetically seal it off from the rest of the world. And indeed, pandemics like this, they know no boundaries. They're global. And the best way to deal with them is through global cooperation, just like that's the best way to deal with the tragedy of climate change. And we're going to see both new pandemics and climate change clash head to head. And it may make this pandemic look relatively mild.
Whatever political and diplomatic direction the US takes afterwards, there's a feeling that this country might be changed for good once the crisis is over.
We will be changed forever. This is a moment in time that has no peer. In my opinion, this will be more transformative than 9/11 was. And the reason is that this affects everybody from coast to coast, within all borders and outside of our borders. The fear is high, and even when it goes away, people will never forget this period of time. And I'm reminded every time I watch TV that was taped from just a few months ago about how transformed human life already is and how it likely will be transformed going into the future.
But those are issues for the future. For now, the priority for most Americans continues to be the battle against the virus that has wreaked so much havoc.
We can't be overconfident until we have some measure of being able to say it's in the past. Because if we get too anxious and we let our guard down and we think we can get out there and back and spread the disease, we're not going to fight this. We're not going to be able to be successful.